Now to your community focus. Today we're joined by Dr. Phillip Chen with the Rhode Island Department of Health. Doctor, as always, thank you for taking out the time.
Thank you for having me.
You know, Doctor, we're hearing from people who are experiencing similar symptoms of COVID but are actually testing negative at at-home tests. Does this mean the tests are missing COVID, or is there something else going around?
So we're currently seeing several respiratory viruses circulating in the community. So COVID obviously causes respiratory symptoms, as we're all aware, but also very similar to influenza and RSV, two other respiratory viruses that are starting to circulate that we know. And in fact, there's many others as well. So we're seeing these other respiratory viruses start to tick up. Interestingly, over the last couple of years, we haven't seen a lot of these other respiratory viruses because everything that we did against COVID protected us against them. And in fact, this year, we're expecting, unfortunately, probably a worse flu season because there hasn't been as much immunity to flu the past couple of years.
Let's stay on the topic of COVID just for a second, Doctor. If you've had COVID recently, let's say in the last couple of months, 3 months, do you need to wait to get that new booster shot?
It is recommended that you can wait if you'd like to get the new booster shot. Obviously, what we've learned to date is that it's critical to get the booster shot if you have not been infected and have not had a recent booster shot or other COVID vaccine. If you've had a recent infection within the last few months, it is reasonable to wait until 90 days after. It's a discussion that you should have with your healthcare provider, and it also depends on if you're immunocompromised or have other serious health conditions.
And what about the flu? We heard Australia had a rough season. What does that mean here for us?
It means that we're expecting here in the U.S. also potentially a rougher flu season. And so that's why it's really important this year as we talk about vaccines, obviously the COVID vaccine, but also the flu vaccine. Again, the flu is not, it's not benign. There's tens of thousands of deaths that we see every year from the flu, potentially hundreds of thousands of hospitalizations. And based on what we've seen in other parts of the world to date, we are worried about it. People should definitely consider getting their flu vaccine. And I think the other good piece of news, of course, is that everything we do to protect ourselves against COVID, whether it be washing hands, staying home while sick, good ventilation, all that protects us against the flu and other respiratory viruses as well.
What about in schools? What should parents be on the lookout for right now?
Similar to COVID, these respiratory viruses really present with a spectrum of diseases, from basically the mild sniffles, a little bit of congestion, runny nose, sore throat, all the way to very severe disease. And so certainly as a father myself, 11 and a 15-year-old, we want to be just a little bit more conscious about our kids who are sick, making sure that they stay home, making sure that they get tested at least for COVID, and of course checking in with their primary care provider for additional questions.
You know, Doctor, we're talking about these flu shots. What about shingles and pneumonia shots, especially for the elderly?
Super important as well. Staying up to date on your vaccines is one of the most important things you can do to stay healthy. I think vaccines are often one of those appreciated advances of medical science. I mean, look, we've eliminated certain diseases like smallpox from the world based on vaccines. Vaccines are one of the biggest medical advances we have. I myself have gotten all the vaccines that I'm eligible for, including traveling across the world. So really want to encourage people, get your pneumonia shot, get your shingles shot if you're eligible, especially if you're older. They can cause very severe disease in the elderly.
All right, thank you so much, Dr. Chen, for joining us here at 4.
Thank you for having me.